And here we are, TikTok Live number 45, top 5 listeners. I give you guys a shout out in the caption of the podcast, the YouTube post. And Luke Hagman just asked the first, or tapped in the first comment. He said, got my Netters Atlas. Love it. Thanks for the tip. Yeah, so we were discussing, I think it was 2 or 3 weeks ago, right? I think it was either TikTok Live number 43 or 44, where we were discussing the best way to study for anatomy. I really do think it's using Netters. It's even better when you're professor or teacher or instructor uses Netters to put in PowerPoints, labels things, and then have a second slide where the labels are stood up, but what the labels mean or indicating are they're blank, right? So you still have the labels are gone, but the points on the anatomical diagram are still there. Does that make sense? And then you back and forth, you compare, and that's how you study them. It's the best way. That's how I study anatomy. My buddy Ian, he's oral surgery resident at UConn now. He taught me that. That's how I got an A in anatomy. It's literally doing that. Luke was pre-dental. Now he's Luke incoming D1. Congrats, Luke. Really huge. Awesome. Love that. Guys, give Luke, both Lukes, give them a follow if you can. C Benji joined. What's up, C Benji? Marvin Hodge joined. C Benji said, how'd the boards go? So here's the thing. I was discussing today with a lot of other residents. One of my buddies is a resident at Yale right now, a chief at Yale. I got another buddy who's a chief Miami. And yeah, we were discussing today how the boards it was a lot of other things. Oh, another guy, he's at New York Medical College, oral surgery. Zach, he goes like, dude, was that the plastic surgery board exam or was that the oral surgery board exam? Like there was like no teeth on it. Literally there was like maybe 5 questions on teeth, implants and such, and not abstract things. It's like an implant nicked the root during the osteotomy of an adjacent tooth. And how long does that cementum take to heal? I don't know. Maybe I should know that, but I don't know. That was a tough one for me. That was not in my study material. That was not in any of my resources that I looked through. And there's a lot of questions like that where it's just like, you know it or you don't. So I was very surprised. Oh my God, so many things on the ears, the eyes, the nose. There must have been like 50 questions on the nose. The only nose surgeries I've done are traumatic reductions. Like I've probably done several nose closed reductions in the emergency department. Just by myself doing that, you fix it to symmetrical again. When you got a nose off to the side like this, you got the nasal bones lacerating through the epithelium, the skin overlying the nasal bridge. And I've never done cosmetic surgery on the nose. And some programs do. I understand that, but like 50 questions on the nose? Anyway, so and there were plenty of questions that I did know, right? But there was a solid like 50%. I have never seen anything on this topic ever. And I've never seen a surgery on this. Distraction osteogenesis too. This is a really good topic and thing to learn about. But like very rarely are we doing that. I don't know. Maybe there are other programs, but we'll see. We find out between like March and August if we pass, and I hope everyone did pass. Usually it's like most residents do pass, but yeah, that exam was not so straightforward. Anyway, Ryan Moon said most common artery hit during the tonsillectomy. I don't know. I haven't done a tonsillectomy. I wouldn't be able to give you that insight. In oral surgery, I'm sure some have done tonsillectomies, but I haven't, and I don't know of anyone doing it in our program either. Flat Gotti said, where did you do undergrad and dental school? Undergrad, I did 2 years at NYU Polytechnic, that's now NYU Tandon School of Engineering in Brooklyn. And then I did my final 2 years at Stevens Institute of Technology. That's in Hoboken, New Jersey, right over the Hudson River from Manhattan. Dental school, I went to Stony Brook. That's out on Long Island. It's about like an hour and a half to 2 hours drive out on Long Island from the city. And it's very quiet out there. It's a nice, small dental school. It was 44 students in the class in my year. And they have excellent placement rate. This is not an ad for Stony Brook, but they generally match a lot of students into specialties year after year. It's a great clinical experience because they keep the school small. They are adding more students to the class, which I disagree with because they're not adding in clinic chairs. So they're adding on more didactics and not clinical experience. I don't agree with that, but hopefully it gets better in the future. Schlackati said, sorry if it's off topic. All good, dude. Officer Angela shared the live. What's up, Angela? How we doing? Roman Ethiopia joined. What's up, friends? How's everyone doing tonight? Happy Saturday. Heather Mitchell joined. What's up, friends? Elizabeth Cole. Do you have your tonsils? I do. I do have my tonsils. Steven said, how are the boards? Yeah, the boards were what the boards were, Toodie said, is dental school worth it? Well, at this point, I'm not truly working yet. I'm still in residency. In 5 months, I'll graduate, and then I'll be working in private practice starting August 15th. I'll be out on Long Island in Melville. Give me like a year or two in private practice, and then I'll be able to give you the gist and like the truth of was this whole process worth it? You know what I mean? Because right now I'm still in residency. This isn't the real thing. I'm still in training. So unfortunately, I'm not there yet. But as far as my goal with dental school was to graduate, and then I wanted to go into oral surgery that I recognized throughout. So, and I did get into it. So far, it was worth it, right? So I think that makes sense. Tonsils. One sec, Renee. I'll get to your question. Tuneless, I'll get to your question. Just give me 1 second. Here we go. Shlakati. Awesome. Thank you for getting back to my question. Yeah, you got it. You got it, man. Tuneless said, have you heard good things about UAB dental school? Generally, I have. I haven't heard too much. What I have heard is good things. I haven't heard too much. They could probably get a little bit more involved with like ASDA. That's just from my experience at dental school, because they have a lot of good people, good students there. They should really promote advocacy and collaboration, and seeing it, networking on a national standpoint. I think the ASDA groups are really good, and I wish more dental students could participate and be a part of them. That Midwest guy said, "Hey man, looking great today. I hope you have a great weekend." Thanks, brother. Thanks so much. And you too. I hope you have a great weekend. Happy Saturday. Tuneless said, I want to do OMFS, but I am not sure if UAB matches a lot of people that match from there. I'm not entirely sure. Guys, Sean and I, we've created the Pre-Dent Mentor Map. If you go to predentmentormap.org, we're trying to add the match statistics of all the dental schools in the United States. Luke, you're starting dental school in the fall. Actually, it'd be late summer, right? Technically late summer. But maybe if you could get involved with ASDA, I definitely recommend that. But number 2 is I'm trying to coordinate with 1 or 2 members from ASDA throughout the country, throughout all the dental schools. And let's get that match data so it's accessible to pre-dental students and dental students, so we could, not to compare necessarily from a competitive standpoint, but I think it's really good to get this information out there, because students that are interested in specializing should know where they may have a better shot at getting into it. And then programs could also compare. They could say, like, maybe we get the board statistics up there, board rates, although they say that everyone passes, right? Every school is going to say that. I think it's really good to get more transparency for data when you're applying to dental school. And then it makes the application process a little bit more involved, a little bit more less stressful for one. I think that's the biggest thing. And that's what we need in career paths such as medicine, dentistry, veterinary medicine, law, that are just so competitive, so stressful, and there's a lot of pressure. Why don't we make this profession and career path a little bit more inviting? And I think this is how we do it, right? So the next step is continuing to build this map. We're trying to add a marketplace where students that have discount codes and giveaways can share posts and insight there. We're really trying to get opportunities for dental students to maybe make a little cash through there, giving insight to those giveaways. Anyway, let's keep moving on. But I want to get that information to students when they're applying to dental school, so that they know, year after year, how many students did match into specialties that they're interested in, because that's the best predictor. Toodie said, is dental school worth it? Right. I just answered a little bit ago. Chocolatey Surprise said, is dentistry your passion? I really like oral surgery. I must say, I really enjoy doing oral and maxillofacial surgery. I love trauma. I love, sedations. I love taking out teeth. I like that I can now take out just about any tooth in the face, right? And I say face, not jaw, because some of these teeth are all over the place, you find out. And oral surgeons are the ones that go and get them if necessary, right? Like if there's pathology involved, maybe there's pain. Yeah. So I would say oral surgery is definitely a passion of mine. And I want to make it better. I want to make the profession of dentistry much better for everyone, because dentists are getting crushed right now, just like doctors are as well. Renee Manier said, do you think DO versus MD matters in the hospital when I become a doctor? I'm a DO student. I really don't. I've worked with anesthesiologists on my 6-month anesthesia rotation with DOs, MDs, CRNAs, MDs and DOs. And some of my friends, I have so many friends on both sides. Do I think it matters? From my perspective, no. They're both excellent people. They are both so smart, and they're really good at what they do on both sides. You know what I mean? It really comes down to the person, the personality, the attitude. That's really what it comes down from my standpoint, in my opinion. Shlakati said, tuneless, yeah, UAB is a great school. Very good school. Good. It sounds like Gotti has a little more information than I do on that, and that's excellent. Thanks for including that. Printer Maynard sent a lightning bolt. Just kidding. Vinay tells you, what's your favorite aspect about surgery, and what do you look forward to when you finish? What I look forward to when I finish is getting a little more time for myself, and I really want to go in and prove my worth to the practice, because I want to be invited. Hopefully, I can be invited to be a partner in the practice. That's really where I want to go. I want to spend some time over the next 5-10 years. One of my new dreams that I just decided on this year, actually, the end of 2024, is I think we need a new dental insurance company that actually, dental insurance companies were created to give patients more opportunity to get the treatment they need, right? And I think we can all agree that's not working right now. They're not making it work. They're trying to make it profit as much as possible. And that's not what insurance is designed for. It's designed to give people more opportunity and access to healthcare. And they have people in the heart of these massive metropolitan areas, these massive cities, and they can't even get the treatment they need. This is unacceptable, and we do need to figure this. We need to come together as a profession, as providers, and make it work and figure out a new way. We got to create a new insurance company. I got several ideas to make this work. I need someone from the inside of insurance companies to kind of tell, like, to get this working, to get this going. It would be really cool to make it transparent where patients could see what's covered and what's not. So that's not like a secret. Like, all these insurance companies are making it. And then also you can see what the reimbursement rate is for providers per zip code. Okay. And so on and so forth in things like that, because everything's a secret, these insurance companies, everything's hidden. They just don't know if they could get the treatment or not. It needs to be better than this. So that's something I'm looking forward to, because I think it'll make dentistry a lot better. Imagine if we can incentivize preventative care. Could you imagine that? Where people, like, you don't go to the dentist just when you have a cavity. Now, you're supposed to go for cleanings, and some of these insurance companies, they only like cover cleanings in the exam. And it's like, what about that crap? Anyway, so I'll let's move on. Bonstone said, I'm outside the top 25 for class rank. Would I still be competitive CBSE score? Yes, I think you should. You got to get that competitive CBSE score. Okay. Can you still get in and rank with a competitive CBSE score? Yes, you absolutely can. You got to show that you're a committed student, right? That you're committed to oral surgery, get some good externships in, and you got to have that CBSE score, because that's how they can really compare you to other students in the country. That's most important. Golfdudeferda, sup Brendan, OMFS here from Michigan here, in practice 27 years. Golfdudeferda, what's up, man? Congrats, 27 years. You've been in the project for a bit. How's it going? What's your experience as far as you've been in it for 27 years? What's something you've seen that you didn't expect over these 27 years? I'm curious. Tuneless said, Shalakati, gotcha. Yeah, I'm waitlisted at Columbia, and I know they match a lot of people into OMFS. That is correct. Toodie, have you heard good things about High Point Dental School? They don't require prereqs. So how do you not require prereqs or a DAT? Do you know who founded that dental school? Do you know who put the money towards that dental school? Follow the trail of money and you usually get your answer. I'm not going to comment on when it's good or bad, but if you do a little digging up of who funded most of that establishment, you're going to get a better idea of where this whole process has come from and where it's going. And once you kind of see that, then we could have that next conversation, which is that a conflict of interest? Catherine Olivia followed the live creator. Thanks, Catherine. What's up? Tuneless said, Shalakati, just don't know which school to choose if I get into Columbia. Well, I would wait. I would visit both schools too. Have you seen them? Have you really walked around the campus? Have you talked to other students there? That's another thing. The Pre-Dent Mentor Map, you can connect with current dental students at either school. I would recommend looking into that. All right. It's pretty good. It'll be helpful. Luke said, yes, a couple schools shared their residency numbers at Impressions Day events. Oh, excellent. Luke said, despite them not being published on their websites. Yeah. Why wouldn't they publish it on their websites then? And then you don't have to wait for, why aren't things everyone should know. What's the secret? You know what I mean? Vinay Patel said, Bondstone, anything above CB 70 is pretty competitive now. Yeah, it's not now. It's always been that way for the most part. 70 is a strong score. Not to say you won't get in with a CBSE score below that, right? But if you're a little bit concerned about your ranking, you got to go all in on that CBSE. That's the truth. Lauren said, have you ever seen a subperiosteal implant? Yeah, we're placing them. It's called the IPS. It's by KLS. It's like a big plate. You do a little fort incision, you reflect everything up. You get all the way back to the zygomas, and then it's a plate that goes along the maxilla, and it's got these arms with plates that go out to the zygomas and up along the piriform, a rim there, and then you screw it in. It's like 20 screws, and that's a subperiosteal implant. It's pretty cool. So we're looking to see how that plays out over the next years. The post-operative, what complications are they going to have? What are we going to have to mitigate over the years to make this more mainstream and better for patient care? Aiden Sullivan followed the live creator. Thanks, Aiden. Toodie said, did you get financial aid for dental school? Nope, I did not get financial aid for dental school. Bonstone said, what are your thoughts of UMich dental school? Also, do you recommend a certain GPA? UMich Dental School, by the way, it's excellent, Bond. It's a very good dental school. I know a lot of people go there. UMich has a oral surgery residency as well, too. I don't know if it's in the dental school. I hope that they have the residents rotate there more. A lot of oral surgery programs, the residents are getting pulled to the hospital setting. They just keep getting pulled for labor and work in the hospital. It's important to be in a collaborative setting, in an interdisciplinary setting with the periodontist, with the pediatric dentist, with the orthodontist, with the general. You need to be working with others, because what this is going to translate to is, general dentists, they're going to be like, why would I refer to an oral surgeon when I can refer this particular case to a periodontist that I know? And we're seeing it a lot more and more. And I don't think we're putting oral surgery for the future years to come at a loss. That's not great. We need to build this profession and make it better. And I think that's something that needs to be considered a little bit more. Jack Wolf 30 said tips for specializing in dental school. Yep, you got to keep your rank up, got to have good grades. I would really try and get yourself immersed and exposed to those specialties as much as possible. And not just one. See a bunch of things. See a wide array of these specialties and parts of dentistry to give yourself the most idea of what you'd be excited to go into, right? Golfdudeferda said hospital work used to be great. Now it's brutal. My advice to make decisions long-term. Oh, always. I'm going into private practice next year. I'll be starting in August in Melville, Long Island. It's just private practice. I'm trying to get as far away from the hospital as possible. It's hospitals, insurance companies, they monopolized all of healthcare. Doctors are now employees. You don't even work for patients anymore. You work for the insurance company, or you work for the hospital that works for the insurance company, and then you work on patients. This doesn't seem right to me. You should be working for patients solely. Yeah, I don't know. We gotta go through further. We gotta make some changes here. What I'd like to do, like I said before, I'd like to create a new insurance company that kind of hones in on certain zip codes, and then reimbursement rates are by the zip code, the area, and it's standardized across the U.S. as far as like a testament or a Bible or a template of this is what we approve and this is what we don't, and then you can see where the reimbursements are per the zip code. The one thing I haven't figured out is what about patients that live in certain states, zip codes? How do we determine what they pay year after year for the insurance, right? Because in different areas, it's going to be going to cost different. So will it be by zip code? But then they're just going to register in another zip code. This is something I haven't figured out yet. But the idea is and like the board of executives cannot be taking a salary. This is for the betterment of dentistry. We can't just be taking profits from this. All the money that goes into the pot need to be reinvested in the patients that bought that insurance. Nothing. And of course, to the staff and the not the administration though of the insurance company. It needs to be solely for the patients. And we have a board of dentists and all specialties that decide the coverage, the reimbursement, what's covered, what's not. And then we also take insight, like the peer-to-peer. Well, right now, the peer-to-peer is a meeting that providers have to schedule with insurance companies because the insurance companies denied it. And then you kind of give your peer-to-peer is like a doctor-to-doctor conversation where it usually ends up being with like a nurse who disapproved this, and then it goes to a doctor if you keep pushing. I'd rather have a doctor on the board of the insurance company speaking with a doctor that's like, this is why this needs to be covered. Because what if they make a great point? You need to change that in the doctrine, in the template, in the Bible of the insurance policy, and then everyone can see this, right? And now this is a collaborative effort where this insurance company can build and make it better and increase the rates according to the area, you know what I'm saying? It can't be a one-sided thing, which is what it is right now. It needs to be completely transparent and collaborative and cooperative with the providers of the network. Benji said, regarding High Point, are you talking about the Workman Foundation that donated? What is the Workman Foundation that donated, right? You know what I'm talking about? You see where I'm going with that? Ice Coffee said, hi, any tips for non-traditional dental school applicants? I have an MPH and took the DAT in October, 20 plus. Good. Any tips? Apply. I'll show that you're non-traditional. And you did it. You got your prerequisites, I'm assuming, right? You took the DAT. You got a 20 or more, right? Apply, submit, do it. You have a great chance. It's going to make you stand out differently from other applicants. That's exactly what you want, right? How's taking out loans? Asked Toodie. Well, I don't know how it works. I don't. I've been very fortunate where I don't have loans. And, that's a testament. My parents worked very hard and did that. And growing up, I was always in before care and after care. And, it was, my parents were always working. And, if that's why I'm working, and, yeah, loans is a very difficult thing, and loans are just going to keep going up and up because loans get approved, and then these institutions get incentivized to keep increasing the tuition. So we need an audit on these systems, and then where that money's going, because it's becoming quite obvious it's not getting reinvested into the schooling and institution itself. So it's such a problem. There's a lot of issues with the systems that are going on right now. There really are. tsrep.tv, I was looking to go to UMich. Yeah, and do it. tsrep said, Toodie, depends where you go. If it's over a certain amount for Fed loans, you have to go private. And I'm sorry I don't know enough about it. All I know is that it's a problem, especially for those that are going to career paths where you're serving people, you're helping patients. That's something we need to work on. I wish I knew more about this. But, the insurance issue is my primary goal here because that's going to change the career for the future. And we need to audit these dental schools, for example, and say, why are you increasing? You need to incentivize patient care because right now the incentive is just to increase class sizes, not clinical work, not patient care. And that's the problem. But the root cause is because of the insurance reimbursement, right? So that's kind of where I'm trying to spearhead because that'll make the profession better for the future. Golfdudeferda said UMich residency collaborates with dental school pretty well. Excellent. I did not know that. That's really good to know. Joel said, how many schools do you recommend applying to after undergrad? As many as you'd be willing to go to. Don't apply to somewhere where you don't really want to go and apply to places that you're interested in, right? BDT00 said, are you buying a practice or becoming an associate? I'm becoming an associate. It's a 2-year contract for associateship. And then hopefully from there, I could be offered a position as partner. That's my goal. That's my dream goal. And there was no mentioning of it now. I expressed that that's my interest and my goal. And now I have to prove my worth. I think that's completely, I agree with that. I think that makes complete sense, right? PS Rep TV, I don't think it should be by zip code, maybe county, but counties are too big. You know what I mean? But that's what I'm saying is maybe it's county, right? This is the discussion I love to have. Maybe county's better than zip code. 100%. I agree with that. But within, say, Suffolk County and Long Island, Suffolk County goes all the way out to the Hamptons and Montauk. Hamptons, some of the richest people in the country out there. And then like my hometown, Smithtown. It's a good town. You can't compare that to like Bridgehampton, right? Sag Harbor, absolutely not. That's why I was considering, it's different zip codes. That's why I was considering zip codes versus and now we have AI systems that can really hone it into specific areas, right? So that's why I think zip codes makes a little more sense. I get the county, but that's my argument for county. You know what I mean? Alba Loves Cats just got the #1 gift your badge. Thanks, Alba. Milan shared the live. What's up, Milan? Ice Coffee said, thanks. Thank you. You got it, Ice Coffee. cbenjiiiii, yeah, I was thinking about applying to High Point, but after researching it, I'm not going to. I don't want to steer you away. You always want to apply to more, and then you could filter out later on, but it's just something to think about, right? What's their incentive to opening this dental school? That's where I want you thinking, right? Because that's going to translate into the experience you have there. And maybe students love it. Maybe it really sets students up for success. But when you have a dental school that's opened by a DSO is a corporation that owns multiple practices of dentistry, right? It's starting to look like it's making the school look like it's a mill to turn out students. They don't care what the scores. They want people that are going to pay tuition, become dentists, and then put them in those practices that they came from, that they own, right? They own the school. They make the dentists. They put those dentists in the practices that they also own. That's conflict of interest. Anyway, Toodie, what do your parents do? My dad was in like business management, actually at Cablevision, and it's no longer Cablevision. It's of Optimum. And my mom was in marketing. Yeah, marketing and PR. Johnny said, what do you think about applying to dental schools right now that still have applicants open? Do it. Apply, man. Apply. PS Rep TV, but I believe for standard loans, the payback is like over 120 months. I'm not sure. Emily Long, Dr. Emily Long, MD, join. What's up, Dr. Long? How we doing? All right, friends. One more question, and then I got to head on out. Happy Saturday to everyone. Wishing everyone a great rest of the weekend. One more question, one more topic, and then I'm going to head out. Who's up? Who's going to do it? Who's going to join? One last one. We're at 25 minutes. Sean Walsh. All right, Sean Walsh got the last one. How was Stony for dental? Pre-med at Stony. What's up, Sean? And congrats. Stony pre-med is excellent. Dental school at Stony Brook, I think is still superior to many of the other dental schools. They have an excellent match rate into specialties. They have a good clinical experience, although they're starting to trail away from the clinical experience, and they're kind of adopting other institutions' policies where they increase how many students they have per class rather than increasing the clinic size. But, and I have a lot of friends and mentors that are faculty there at Stony Brook, and they are excellent. They are outstanding. Dr. Nick Nicastro, you got Dr. Georges Romanos, you got Dr. Seaver, you got Dr. Fazio, you got Dr. Conti. They're excellent. Dr. Swanson, she's excellent. A prosthodontist. You have some really good instructors and mentors in that program. And I think, through such a stressful time in your career, dental school is very stressful. You need certain mentors that you could go to with questions for advice and to kind of help you see it from a different perspective, maybe see things, learn how to do things more effective and more efficiently. I think that's excellent. Okay. All right, friends, I'm signing off and wishing you a great rest of the weekend. All right. Thanks for coming on and joining. I love you guys. Top 5 listeners of this episode. This is TikTok Live number 45. I'll be giving you a shout out in the caption of the YouTube post and podcast. All right, friends. Love you.